Yes. Welcome, everyone. Welcome you. I'm going to welcome you and thank you for joining us today. But first, I want to say Happy New You in 2022. Today, we are bringing to you something really very special. And so I'm glad that you are here. We are introducing CORE, CORE, which stands for Community Oriented Recovery and Empowerment. It is our second town hall series, and it's hosted by a new group that started in August of 2021, Access to Recovery Coalition, or A2R. Welcome, everybody. Thank you for spending time with us today. And so I just want to spend a little time introducing who will be participating and facilitating during this series. First, I want to talk to you about the Access to Recovery Coalition, which I'm a part of. And the Access to Recovery Coalition, or A2R, it's a coalition of directly impacted people, peers, and providers. We are working to improve access to medical and mental health supports in health and recovery plans, also known as HARP, HARPS, and also the HIV Special Needs Plan, also known as HIV and SNPS. This Access to Recovery Coalition is a project of the Urban Justice Center Mental Health Project. And we are so happy to be here to help and to assist and to make sure that you get the access to supports that you decide. Next, who will be presenting and participating is the New York State Office of Mental Health, also known as OMH. And OMH is a state agency dedicated to promoting the mental health of all New Yorkers with a particular focus on providing hope and recovery. Now, it's not just for all New Yorkers, it's all the Eastern Seaboard, and also they help us across the country. So I just wanted to point that out. Next slide, please. And so in a brief snippet, I want to show you what we're going to talk about today. So number one, what is HARP, H-A-R-P? What is CORE, C-O-R-E? And who's going to help us to do that is the Office of Mental Health. Number two, what are CORE supports? Who's going to help us to illustrate that is the Office of Mental Health. Number three, what do I get? How do I get CORE supports? And again, Office of Mental Health will present that for us to understand. And also, grievances and quality issues. A lot of times we don't know what to do. And so A2R, Access to Recovery, we're going to show you how to do that. And then after the town hall meeting is done, well, we're not going to be done, but after we're finished having our conversation, you'll hear a little word from the Office of Mental Health and the Office of Chemical and Assistance. I think I got that wrong, but they'll fix that up. So next slide, please. So just so that we can just have some format, the format is that we're going to present to you a topic, right? It might be new, might seem kind of familiar, but we'll present to you a topic. And then we'll stop for feedback and questions from you. And that's very important. And then after the presentation is complete, we're going to go into breakout rooms so that we can ask more questions and clarifications and just make sure that we presented to you information that you can digest. And now we're going to go into community agreements. The first community agreement is nothing about us without us. So we're not going to make decisions, and the decisions are not going to be made without our input. And so nothing about us without us. That's very important and empowering. The second one is one mic and move up. And so it's okay if you don't have anything to say right now, but please try to write a little, jot something down and say something. And we want to give everyone a chance to speak. So if you've spoken once or twice, you want to open the door for other people to speak as well. Number three, speak from your own experience. So I will say, I need some help in getting additional services. And so it's all right to say I statements because it's about you right now. Number 4, learning and sharing mindset. This is a safe space for us to learn and for us to share. And the best place for us to really share is in the breakout room. So don't be shy. Number 5, mindfulness around oppression and power. We don't want to do any name calling or anything like that, or, to generalize and say the system is this or that, but it's about you and how you reach in to get the supports you need. Number 6, this is part of a longer journey. And so you may leave with some questions, you may leave with some ideas, and we want to stay in contact with you so that if you think of something afterwards, or if you think of something that maybe we need to have further discussions on, we will be able to do that. And number 7, it's okay to change your mind. If you don't want to stay in close contact with us, it's okay, but we'll be here. And if you want to share your information, you can do that. So next slide. So we're not going to have any much feedback and sharing questions right now, but we'll do that throughout the presentation. Next slide. So this is where our friends, our partners, our stakeholders in the Office of Mental Health, both Lynn and Katie, will be able to share some information about what is community-oriented recovery and empowerment services and what we need to know. So Lynn or Katie, please take it away.
So sorry, this is Frankie Herman. I just want to jump in right quick and do a little bit of housekeeping before we get into kind of the meat of our program here today. I just want to, let folks know, so this meeting is being recorded and we might publish it. So you can make a, informed decision about what you choose to share or not share in this space. We also want folks to know if you want to share something during the question and answer session. If you're on video, you can just click the little raise hand to speak, and we have folks kind of keeping an eye on who's raising their hand to help make sure you don't get missed. If you're on the phone and you want to raise your hand, you can press *9 or *9, so *9 on your phone, and that will raise your hand. And in order to mute or unmute yourself on the phone, you can press *6 or *6. And we always love to see your face, but if today you're not feeling camera capable, that's totally okay. We love to have you however you are in this moment. And I will go ahead and pass. And who's speaking, who's doing the presentation next after me?
I am Frankie, thank you. Lynn Schaefer.
Lynn is, okay, hang on, let me spotlight you.
Okay. Ready?
All set.
Okay, so thank you, Frankie, and thank you, Chaplain Mitchell. Welcome, everyone. I'm really glad to be here today. My name is Lynn Schaefer. I work for the Office of Mental Health in the Division of Managed Care, and I am part of the team working on this core service implementation. So this presentation is for people interested in community-oriented recovery and empowerment services, also known as core services, to learn more about what they are, how they can be useful, and who can access them, and how you get access to them. The Office of Mental Health worked closely with our colleagues at the Office of Addiction Services and Supports to incorporate stakeholder feedback throughout this program design. Thank you so much for the opportunity to speak with you today. We're excited to share information with you and to learn from you. Next slide, please. So throughout the presentation, there's going to be a lot of acronyms used on the slides. Apologies in advance, that's just how it goes. I'm going to do my best to tell you what these all mean, and then we'll get into some details. Next slide, please. Okay, so on this slide, first of all, I just want to bring your attention to the note in the box at the top of the slide. Behavioral health services is a phrase used to refer to mental health and addiction supports paid for by Medicaid. Okay, and that's what they mean, is their mental health and substance use supports paid for by Medicaid. Okay, now on to the acronyms. HARP, a health and recovery plan, is a kind of Medicaid plan that provides more behavioral health services than your standard Medicaid plan. The state uses an algorithm, a formula run by a computer to figure out who is eligible for HARP. So this algorithm looks at historical use of services, including hospitalizations, emergency room visits, and other behavioral health services. The level of intensity of those services and the volume of them informs the algorithm. So that's how the algorithm knows who's eligible for a HARP. Right now, there's no community referral option for a HARP. Only people identified by the algorithm can enroll. An HIV SNP, HIV SNP, or HIV Special Needs Plan, we call those special needs plans, we call them SNPs. So this is an HIV SNP, is a type of Medicaid plan for people living with HIV. If someone is enrolled in an HIV SNP and they also meet that HARP eligibility algorithm, they can access HARP benefits like adult behavioral health, home and community-based services, and community-oriented recovery and empowerment services. What are BHHCBS? That stands for Behavioral Health, Home and Community-Based Services. These are behavioral health services available through HARP and HIV SNP for people who are HARP eligible. And then finally, the reason we're here today is to talk about CORE. CORE stands for Community-Oriented Recovery and Empowerment Services. CORE services are a set of behavioral health services available through HARP and HIV SNP for people who are eligible for HARP. Something that's really important to know is that if you've ever received BHHCBS, or if you are receiving BHHCBS, some of those services are converting to CORE services. We will look at the breakdown of those in a couple of slides, so you can see if your services are impacted by this change. Next slide, please. All right, and this is just to review. Health and recovery plans and HIV special needs plans are Medicaid managed care plans that cover or pay for more behavioral health services than a standard Medicaid plan. And the whole idea of this is to get you the support you want to meet your goals. These services can help you increase your overall wellness. They can improve your life satisfaction, help you to build or improve relationships in your personal life, live independently, go to school, and find or keep a job. Next slide, please. So this slide is really just a visual representation of the slide we just looked at, showing how HARP or HIV SNP can lead to more behavioral health services, those CORE and BHHCBS services that we spoke about, if you're eligible and interested. HARPs and HIV SNPs also have some benefits that are important to be aware of in addition to CORE and BHHCBS. These Medicaid plans include additional behavioral health staff at the health insurance plan. They include enhanced care coordination, and they aim to support a higher quality of life. So most of the rest of today's presentation will focus on CORE services specifically, as these are rolling out in 10 days on February 1st. We want you to know that CORE and BHHCBS have different referral and intake pathways, which we'll be talking about later on in the presentation. Our goal today is for you to walk away feeling confident that if you're interested in CORE, you have some good next steps to get this important benefit if you're eligible. Next slide, please. All right, so before we go into detail about those CORE services, let's talk about how you would know if you're eligible and enrolled in the right type of Medicaid managed care plan, that would be a HARP or an HIV SNP, in order to get them. So first of all, you need to be at least 21 years old and enrolled in Medicaid managed care. You need to be found HARP eligible based on the type and number of mental health or addiction services used. This is determined based on that algorithm that I talked about a little bit earlier. Once you're identified as HARP eligible, you need to be enrolled in a HARP or an HIV SNP. For many people, this just happens automatically. Finally, once you're in the correct type of plan, you would follow the referral and intake process for CORE and BHHCBS, which will be described later in this presentation. If you have questions about eligibility or enrollment, you can contact your health plan directly, or you can call New York State Medicaid Choice. The number is here on this slide. And if you need assistance reaching out to your health plan or to New York State Medicaid Choice, there are resources available to you, including Access to Recovery, CHAMP, which stands for Community Health Access to Addiction and Mental Health Project, and ICANN, which stands for Independent Consumer Advocacy Network. Okay, next slide, please. All right, so here you'll see two menus of services, one for CORE services on my left, I'm not sure if it's going to be your left, in the red, let's call it in the red, and another for BHHCBS in the green. As of today, January 2022, all of these services, the red and the green, are available through BHHCBS. But starting in February, those ones that are in the red are going to be available as CORE services. So both of these benefits are available through HARP or HIV SNP for eligible people. You can choose to receive services either through CORE or through HCBS or both. You can also choose to access different services from different providers. Like, you might get education support services from one agency and peer support from another agency. The rest of today's conversation will focus on core services. What are they and how can they help you meet your goals? And my colleague, Katie Merrill, will be speaking to that. But I think first, next slide, we have some time for questions, answers, and feedback. Thank you.
Thank you so much for that. You really made everything really very clear, at least it is to me. And I hope that our audience, you take the time to think about the questions that you may have that pertains directly to you. So I'll start off the questions. So if I want to get a job and I still need to go to my therapist, my behavioral therapist, and I need some physical therapy, would core services be able to help me?
Would core services be able to help you with physical therapy?
No, I have all this stuff that I have to coordinate. I mean,
I
what am I
see.
gonna do? Who am I going to reach out to? Would I be able to say, well, okay, core, can you help me? I need these things, I'm not quite ready to go back to work, but I need to still keep my behavioral health services, and I still need to get, some physical therapy done, and I want to start looking for a job. Would these core services and behavioral health services work together?
Yeah, so I'm actually going to pass that question on to Katie. Thank you so much for asking it, Chaplain Mitchell. It's a really important question. Care coordination and figuring out where you're going to be able to get all the things you need and how you're going to coordinate that is a big challenge. I work in the managed care division. I don't really have so much of the clinical background that Katie does. So Katie, is that something that you could address, please?
Sure, I can try to address it. So when you're dealing with a lot of different issues that could be on the medical side and on the behavioral health side, your first stop, if you have a care coordinator, is to talk to your care coordinator, because it is a lot to manage. There's so many appointments and you want to make sure that you're keeping up with the behavioral health side and the medical side. So if you have a care coordinator, they're a great person to talk to. Now, if you just really want that job and that's what you're focused on, I do believe that core psychosocial rehabilitation could be a nice support for you. They're going to work with you to figure out what kind of job might you be interested in? What skills do you need to get that job? What are your strengths? They'll figure out, like, have you worked before? Do you need help looking for a job, or do you need help with interview skills? Do you need help with time management? Like, what is it that's the mental health barrier to having that job that you want? And then they'll work with you to address it. But you brought in like the physical therapy piece. And so if you're trying to balance like the psychosocial rehabilitation that might be available under core with all of your other therapies and appointments, I think that would be more the role of the care coordinator than of the core provider. I hope that.
Through HARP, right? Through HARP, right? Through HARP, my care coordinator?
I'm thinking through your health home care management agency, which is a benefit under the HARP.
Thank you. Thank you so much. There's light and we are not in the tunnel. Are there any questions from the audience? You can raise your hand, or if you're on the phone, star 6.
There were two in the chat, but they already got answered.
Okay. Thank you. Any questions before we go on with the presentation? And please.
It looks like Juliet is raising her hand.
Oh, wonderful.
Sandra, cool. Thank you. Thank you, Sandra.
Juliet,
Huh?
is there Juliet? She wants to.
Oh yeah. Thank you.
Yeah.
Yeah. So thank you. So I hope this is an appropriate question to ask now, but I'm part of A2R. I work at the Urban Justice Center's mental health project. So, I get a lot of HARP questions and people needing support with that, of course. I don't know if it's going to throw a little curveball, but I heard recently that, like, let's say somebody becomes eligible for Medicare. Like, this is an issue that comes up, once we switch to that, and like somebody who's afraid of losing their HARP services, HCBS services, because now they have Medicare, they become eligible for that, potentially based off of using the HARP services and gaining work employment. So now they're eligible for Medicare because of SSD. I heard that in 2023 that HCBS services are being incorporated or might be incorporated into some sort of different plan. I'm just wondering if you could get clarity there in terms of people who might switch to Medicare or because of aging, and how they can maintain their HARP services, if that makes sense.
Yeah, I mean, this is Lynn. That is a complicated question, Juliet, and it's even more complicated because it's a little different now during the public health emergency than it will be when that health emergency is over. And I don't know that I want to say anything out of step here. Right now, you have to be enrolled in a HARP or an HIV SNP in order to get core services and BHHCBS services. There is some conversation about having some of those services also covered by like a Medicaid Advantage plan sometime in the future, potentially in 2023, in which case they would be available to people who are enrolled in that kind of plan. But right now, if you are enrolled in Medicare, you don't lose your Medicaid because of the public health emergency. So you can still get your core services. But usually, or really anytime, if you're not enrolled in the HARP or the HIV SNP, you don't have access to core or BHHCBS. That's the general rule. You need to be in the HARP or the HIV SNP to have access to these services. Does that help?
That does help, thank you. I guess my only final, and again, I don't want to make it more complicated, but just my only final thing is like, again, like this 2023, that I think OMH might have said that maybe something would be changing then. I don't know if that rings a bell. Something about 2023 and HCBS services being like incorporated somehow. I don't know if that rings a bell.
That's still a tentative thing. I don't know that there's anything more to say about that right now.
Okay, thank you.
You're welcome.
That is wonderful. Thank you for your questions. And there's no wrong question. Remember when they used to tell us that in elementary school? But we really mean it here. So we'll go on with the presentation. Next slide, please.
Sorry, Chaplain Mitchell, there is one more question in the chat from Ellen.
Sure. Please.
She asked, where are these services physically located?
So I'm actually about to get into those details. I think they are covered pretty extensively in the next section. So rather than answer now, I think maybe we can go on with the conversation or with the slides. And if it's not answered after that, we could come back to it.
That sounds great.
Okay, thanks.
And
so
you'll be
much.
the first one, so we were looking for you. So go ahead, please.
All right. Hello, everyone. My name is Katie Merrill. I'm the Director of Rehab Services here at the Office of Mental Health. And I'm going to talk to you about what core services are and what they could do for you. So next slide. I first want to start with some brief overview, key facts that are true about all core services, and then we'll go into the details of the specific services. So here's what I really want you to know. Number one, these services are available in the community. So the staff are going to meet with you in the places where you live, work, learn, socialize, hang out. It's a flexible, mobile support, and the core provider, the staff person, is going to work with you to figure out where you want to receive that support, where it's going to be comfortable for you. Core services may be provided by telehealth. So that's something that you can talk to your core provider about if they have telehealth as an option. If they do, they're going to engage you in a person-centered planning process to determine whether telehealth is the right level of service for you, whether it's going to help you get to your goals. Now, the nice thing is that you don't have to choose between only telehealth and only in person. There is the opportunity to engage in both. So if you're someone who's really concerned about COVID-19 numbers, and maybe when community spread is higher, you opt for telehealth, and then when the case counts come down, you want more in-person services, that is something that can be done under core. Core services should be really easy to access for individuals who are eligible. You don't need the standard eligibility assessment. You don't need to join a health home if you don't want to. And you don't need a referral from a care coordinator or a recovery coordinator. In fact, you can self-refer to core services. And that's so exciting because we really think that's going to help people get to these services much faster and much easier. Now, the amount and kind of services and supports that you receive are going to be based on an individualized service plan, or ISP. And that's going to be developed between you and the core provider during the intake process. You can always adjust the ISP as you make progress or as your goals change. So it's not something that you have to commit to on day one and you're stuck with it. It's a very flexible document that just says, this is the level of support that I want and that I think and that the provider thinks are going to get me to my goal. All right, next slide. So there are 4 core services, and I'm going to introduce a few new acronyms here. The first one is Empowerment Services Peer Support, and we don't typically use an acronym for that one. Usually we just shorten it to peer support. Family Support and Training is sometimes called FST, Psychosocial Rehabilitation, or PSR, and Community Psychiatric Support and Treatment, or CPST. The next few slides are going to go into a little bit more detail on what each of these are, and ideally it'll help you figure out which ones you might be interested in and which ones could help you pursue your goals. You could choose to receive just one service, or you might choose to receive them in any combination that's going to work for you. All right, next slide. So let's talk about peer support first. And the reason I talk about peer support first is because under BHHCBS, the Home and Community-Based Services, this was the most popular service by far. People really like peer support, and it's no surprise. When you're getting peer support, you're receiving services from someone who knows what you're going through because they've been through it themselves. They can share their story of recovery with you, offering support and helping you to navigate the system and your community to build the life that you want. So on this slide, there's a few examples of what a peer might do for you. These are just examples. They could certainly do more. It's a very broad service. So number one, they could help you get engaged in communities of your choice. This could mean finding a book club at a local library, joining a gym, finding a community center, or even a faith community. They want to help you find a place that's going to be meaningful to you, where you can be yourself. They might help you build self-advocacy skills and knowledge so that you can confidently advocate for yourself with your family, with landlords, with doctors, really in any setting. They want to make sure that you're able to advocate for yourself. They can help you find and get the supports that you need, whether it's Social Security, a recovery center, a warm line, care coordination, a primary care doctor, or even an online peer support community. The peer specialist is going to help you access supports that are the most important to you and that fit with your lifestyle. Now, peer support isn't meant to replace a care coordinator, but really their goal is to help you find paid services and unpaid services that are going to move you towards your goal and help you to access those independently over time. Now, finally, peer support offers the help when and where you need it most. So at home, in the community, day, evening, or weekend. I want to give you a quick example of how peer support could potentially help an individual. Many of us have experienced difficulty speaking up in a doctor's appointment. It can be really intimidating to be honest with a doctor and to ask your questions, especially if they feel like they're in a rush, if you feel like the doctor is in a rush or like they aren't listening to you. A peer specialist could actually attend that doctor's appointment with you and just act as a support who can give you the confidence that you need to ask questions or to make changes to your treatment plan. They could also share their own experiences with you around self-advocacy and getting the medical establishment to take them seriously. A peer specialist could help you think of and rehearse questions in advance so that you feel more confident when it's time to ask the doctor. These are just a couple of ways that a peer could help you build your knowledge and self-advocacy skills so that you feel empowered to make informed choices and take control of your healthcare. All right, next slide. Family Support and Training, or FST. This is a service that's offered so that your family of choice can be involved in your recovery. Your family of choice could include the people who live with you, or who otherwise provide you with support. So that could be your parents, significant others, children, relatives, mentors, roommates, anyone you choose to call family. Through family support and training, you and your family of choice will identify goals, strengths, and resources that will support your recovery. This service is all about you and how your family can support you. Your family of choice will also receive education on how to better support you. So they'll get factual information about things like mental illness, addiction, and recovery. They will also develop skills to maintain positive relationships moving forward. I'll give you a quick example of how family support and training might help. Perhaps an individual has a very strained relationship with their parents. They love their parents, but just don't see eye to eye on some life choices. Parents of adult children sometimes think that they still know what's best, and that can really put a lot of strain on that relationship. They may not understand your diagnosis or how it impacts day-to-day life. A family support and training provider could help this individual's parents to get good factual information on mental health and addiction, information on recovery and empowerment, and they can help the individual and the family to improve their communication skills and set healthy boundaries so that everyone in the family feels heard and respected. Okay, next slide. Psychosocial rehabilitation, or PSR, is really a jack of all trades service. What I mean by that is that PSR can help you to improve your life satisfaction and wellness, whatever that means to you. It's an incredibly popular service that focuses on helping you achieve goals related to where you live, work, learn, and socialize. Through PSR, you can receive supports at home, at your job, or in the community. So it's incredibly flexible, just like the other services. You will develop skills to improve your life satisfaction and wellness. Now, by skills, that could be a variety of things. It could be anything from mindfulness exercises to banking and personal money management, job search and interview skills, or harm reduction techniques. You name it, if there's a skill you need, psychosocial rehabilitation can help you with that. You can also learn and apply skills to manage your mental health and addiction concerns so that you can achieve your personal recovery goals. You can learn to manage stress, prevent crisis, and get the quality of life that you want. There are so many examples of what PSR might look like for an individual. So for today, I'll just give you one. Perhaps you're an individual who wants to move from a community residence or your family's home into your own apartment. In this example, psychosocial rehabilitation providers would work with the individual closely to figure out exactly what skills they need to develop or refine and what resources they need to reach that goal. The provider can help this individual navigate benefits that may be available, like rental assistance or housing vouchers. At the same time, they can help the individual learn personal budget skills, money management skills, so that they know how much they can afford. The PSR provider will be there every step of the way to make sure that the individual is making progress towards their goal. And if something isn't working, they can change approaches. So you're not locked in. You know, they're going to be really flexible and work with you and make sure that you're moving forward and achieving that life that you want. Okay, next slide. Community Psychiatric Support and Treatment, or CPST. This is a service that's provided by licensed professionals like therapists and doctors to address barriers that impact your everyday life. Think of this service like mobile therapy. With CPST, the therapist or clinician comes to you. You can receive therapy and supports for you and your family of choice. This could even include family therapy that's focused on your recovery goal. CPST will help you identify personal stressors in order to better manage that stress through coping skills. You can also learn to prevent experiencing a crisis. Community Psychiatric Support and Treatment also offers support for individuals living with both mental health concerns and substance use disorders, including tobacco use, so that those individuals who struggle perhaps with both mental health challenges and addiction challenges can achieve recovery and get the quality of life that they want. I'm going to share with you an example that I hear all the time from community psychiatric support and treatment providers. There are so many individuals who have tried therapy and counseling, and for whatever reason, it just didn't stick. transportation issues, scheduling issues, even the stigma associated with walking into a clinic. These are just some of the reasons why individuals who want therapy haven't been able to stay consistent. CPST allows the therapist or clinician to come to you. They offer flexible scheduling so the individual can meet with the therapist right in the comfort of their own living room, or perhaps they want to go for a walk and enjoy some sunshine in their local park or neighborhood and do some walking therapy. That's also okay. Through this, the clinician is going to figure out how to minimize those barriers to therapy, whatever it is, whether it's the transportation issue, whether it's social anxiety, whatever the issues are, the therapist is going to be able to address those with you. Many CPST providers, or I should say some CPST providers, will also have psychiatrists or nurses who are available in addition to therapists. So if you want medication therapy and that's something that you're interested in, or if you're trying to manage a chronic health condition and talking to a nurse about that would be helpful for you, some CPST providers will be able to offer that level of support. It would be important to ask up front, do you have doctors and nurses available? But we'll talk a little bit more about that referral process in the next section. So if we can go to the next slide, I think this is a good stopping point to try to answer any questions or hear feedback and sharing from the group.
Philip had a question in the chat.
Oh, I asked, how can we obtain a copy of the HARP and HIV special needs plans, that list?
Hi there. So this is Lynn. We actually shared a list of the HARP plans with our colleagues in the Office of Consumer Affairs. Liz, do you know, or Chris, how that can be shared with the larger group?
I imagine it's something that we could help send out. Chris, correct me if I'm wrong about that, but that seems like something reasonable that could go out on our listservs, yes?
Yep, we can share that on the listservs for sure.
Thanks.
Mm-hmm.
It's also available, I believe, on MCTAC, which is, I think, the Managed Care Technical Assistance Center, which is what it's called. I think if you look up mctac.org, they have what's called a plan matrix. I'll see if I can find the link to it and put it in the chat while we continue talking.
This is Frankie Herman. I just wanted to jump in and say as well that we'll be providing copies of all these slides as well as some additional resources after all 3 of our town halls are complete. So in the first week of February, and we can be sure and include either a link to that or the chart itself in those resources.
It looks like Daniela also put a link up in the chat as well.
There it is. That's it. I was just about to put it.
Thanks,
Thank you, Daniela.
We do have another question in the chat. I'm sorry, I don't want to jump in, but I'm not sure where Sandra went. So what's the difference between CPST and ACT services?
Well, I could do a whole presentation on that. There's a lot of differences. If you're looking to draw a comparison between CPST and the level of support that it provides, if you're trying to compare that to the traditional behavioral health system, I would compare it most directly to clinic. Assertive community treatment is really a multidisciplinary, comprehensive, team-based approach. The way that it is funded is completely different. And with ACT teams, you have this multidisciplinary team who will go out and find the individual to engage them. With CPST, the way it's funded and the way it works, there's really no going out to find someone. So you would have a set appointment and then you would go and meet with them. Many CPST providers will not be able to offer the medication management piece. So they would be working with the individual to connect to their primary care or to an outpatient clinic for the medication management piece if that individual wanted and needed medication management. But it's not a comprehensive service. It doesn't offer the peer support or the family support or the vocational support that would be available through a multidisciplinary ACT team. It's really focused on mobile therapy.
Thank you.
We
Oh,
have
go ahead.
sorry, we have another question in the chat from Ellen. Ellen, I don't know if you want to ask or not, but I'll just read what's in the chat. It says, it is most difficult to find psychiatrists and therapists. Do you have these professionals available when you can't find an available professional?
So I would say that the entire state is in a bit of a workforce crisis in the field of behavioral health. There are not enough therapists and psychiatrists and nurse practitioners in the state. And so is that true of CORE just as much as it's true of any other service? Yeah, there could be times when there's a waiting list because no one has enough therapists and psychiatrists. I would say the best thing that you can do is to call a designated provider. And we'll talk in the next section of the presentation around how you can find a provider and ask if they have capacity and room to accept referrals. Many CORE providers do, so that's the good news. The prescriber piece, the doctors and the nurses are going to be a little bit harder than perhaps a social worker or a mental health counselor to find.
Chaplain Mitchell, you are muted, so I don't know if you're trying to speak to us or not.
Oh, yes, I'm trying to speak. Thank you so much. So thank you all for all of your questions. And we're going to go at this time. There'll be in the breakout rooms, there'll be much more time to ask more questions, but we have some really great things to share with you about how to do these things that we're talking about, how to connect. So next slide. Right. How do I get CORE services? And who's going to present this to us?
Still Katie.
Still Katie. Thank you, Katie. Go ahead. You have the floor.
Thank you, Chaplain. Okay, so now that we've talked about what CORE services are and who can receive them, let's talk about where you can actually get them. Next slide. So the good news here and the biggest takeaway that I have for you is that there is no wrong door to CORE services, which means a referral should be very, very simple. There's no wrong way to get CORE. And that's really good because if you recall with behavioral health, home and community-based services, there were sometimes a lot of hoops to jump through it before you got to an intake appointment. We think we've addressed most of those issues and that the referral to CORE will be very simple so that people who want these services can get them. So on this slide, what you see here is a list of some of the examples of people or organizations who might help you get to CORE services, who might make a referral. This is not an all-inclusive list because when I say no wrong door, I mean no wrong door. Anyone can refer to CORE. So some examples, a care coordinator from a health home, a hospital inpatient unit who's maybe doing some discharge planning for someone who's being discharged, whether it's medical or behavioral health. If that person would benefit from CORE, then the hospital could make that referral. A therapist or a doctor, a health plan. So your insurance company can make that referral. Family and friends, maybe if they see that their loved one is seeking out services and they do some Googling and find a CORE provider, family and friends can make a referral. My favorite one is a self-referral. That is how easy this is. If you are eligible and interested, you can pick up the phone and call a CORE provider directly to make a self-referral. Or you could engage a peer support specialist or a peer navigator to help you with that process. Now, as you look at this slide, you might be wondering, okay, there's no wrong door, but is there a way that's better than the other ways? Is there one of these that's going to get me an intake appointment faster? And the answer really should be no. The CORE provider is going to work with you to schedule an intake as soon as possible, no matter where your referral is coming from. So even if you self-refer, the process once you get on the phone with that CORE provider should look the same. All right, next slide. So as you saw on the previous slide, there's more than one way to access CORE. We hope that anyone who is eligible is able to get it as quickly as possible without the hoops to jump through. Here's a few ideas that we have for you if you're trying to get connected to CORE. First, you can go ahead and reach out to the CORE provider directly, make that self-referral, and start the intake process as soon as possible. Now, if you're going to make a self-referral, there's a couple of things that I want you to know. Number one, you may want to ask right up front if they accept your insurance. So not every CORE provider accepts all of the HARP plans in New York State. So if you have Emblem, if you have Fidelis, if you have Health First, make sure that when you call and make that self-referral, you say, here's who my insurance is, do you accept them? That's going to save you some pain down the road if they didn't take your insurance. Now, if you're wondering, how do I even find a CORE provider in order to ask them that, we do have a list on our website. It's called the CORE designation list. We can get you a link to it. And we are working, by the way, on adding them into our larger provider directory, the Find a Mental Health Program function. Some of them are in there already, and we're working on making sure that they all get into that database. You could also contact your health insurance plan to ask them who's in network, which means they are participating in that plan and the plan will pay for it. So you could contact your health insurance plan. And lastly, if you have a health home care coordinator, they would be an excellent person to talk to about this, because they're probably going to know a number of the CORE providers personally and could help you find the right fit for you based on what your needs are, what your goals are. They're going to have the inside knowledge around where the waiting lists are and aren't. So if you have a care coordinator, I would really encourage you to talk to them. Now, just like any other benefit that's covered by your insurance, the CORE provider needs to document medical necessity, which means that the services were needed in order to support your recovery. The way that they do that is through getting a recommendation from a qualified provider known as a licensed practitioner of the healing arts, or LPHA. So you need an LPHA recommendation. On the next slide, I'm going to give you some examples of who these qualified providers are, who the LPHAs are. The LPHA fills out the recommendation form. It's a very simple one-pager. It's mostly just some check boxes and a signature saying that, yes, they do agree that based on your mental health challenges or addiction challenges, they think that CORE services would be appropriate for you and would help you with your goals. That form, if you want to see it, is on the OMH website. We do have the link in the slide. The LPHA recommendation, it's important. It is part of the intake process. But if you're interested in CORE and you think that you might be eligible, I don't want you to worry about the paperwork. That is for the CORE provider, the agency that you go to. That's their job to worry about the paperwork. So I don't want any HARP member or HIV SNP member to worry about getting that paperwork done. That's on the provider. So I want you to know what the process is, but don't worry about it too much. You can start the intake process. You can meet with a CORE provider and start talking about what your goals are before that recommendation is completed. They will do it as a part of the intake. All right, next slide. So I told you I'd tell you who the LPHAs are, the licensed practitioners of the healing arts. Here's some examples. We've got psychiatrists, licensed clinical social workers, or LCSWs, nurse practitioners, physicians and physicians assistants, and licensed mental health counselors. These are just some examples. If you want the full list, you can check out the LPHA memo that's linked on slide 24, because the full list is right there on the recommendation form. A quick rule of thumb, though, is that most nurses, doctors, and licensed therapists are qualified LPHAs. So that's the easiest way to remember it. Okay, and next slide. Now, what if I'm already receiving adult behavioral health, home and community-based services, community psychiatric support and treatment, or CPST, psychosocial rehabilitation, or PSR, family support and training, or FST, or peer support? So what if you're already getting those under BHHCBS? The good news is your services are going to continue as is. Your current provider will work with you to make sure that you understand what's happening with CORE and to update your individual service plan or ISP to reflect the change over to CORE services. But really what we think the changes would be might just be increased flexibility. Under CORE, we've actually opened it up so that they can work with your family more readily. They can work with other providers more easily. And so the only changes to your ISP would be to make it stronger and better. It wouldn't be any kind of reduction in service or anything like that. Okay, and with that, I believe we can go to the next slide. And we are at another pausing point for feedback, questions, or sharing. Chaplain Mitchell, you might be muted if you're talking.
Can you hear me now?
There you go. You're good.
Oh, wonderful. I just was thanking you, Katie, for making things really very crystal clear, especially helping us with those acronyms. Alphabet soup makes me don't know what I'm talking about. So do we have anyone in the chat? Anyone on the phone? Anyone in the chat? Anyone in the phone? Star 9.
There's no one in the chat right now, Chaplain Mitchell.
Okay.
But
So I have a question.
Chris did send a helpful resource there. Go
Yes,
ahead.
and I saw that. Thank you so very much. Chris, I want to thank you. I am working from my Android phone and I am working with one finger. And so I really, really do appreciate those who do have the technology at their fingertips that you are sharing in the chat so that we have that information right away and we can become familiar with it. Thank you so much, Chris. I have a question. What if, this is just a hypothetical question. What if I want to include in my individual service plan my significant other, and we're not married, to come with me to the doctor's office? And what if I want to have them be a part of my therapy because they're my family? Could I do that?
Yeah, so core services are not typically provided in a doctor's office, although as I mentioned in the example, like a peer may go to a doctor's appointment with you. But I think the heart of your question is, can you identify an unmarried partner as your family of choice? And 100% the answer is yes. So if you want a boyfriend, girlfriend, domestic partner, significant other involved, and you're saying, this is my family, all you need to do is say, this is my family. And they can 100% be involved in your services.
That's awesome. And then another question. Yeah, perhaps I am concerned about the numbers rising of COVID, Delta, Omicron, whatever they're calling it now. And I want to ask for telehealth. But sometimes I want to go in too. Do I have that flexibility?
Yeah, so each provider individually needs to, this is a little complicated, but apply for telehealth. Right now, under the pandemic circumstances, I believe all of our providers are telehealth providers. So if the agency itself is doing telehealth, then yes, under core, you have the flexibility to switch back and forth or to get both. You know, you might get telehealth on Monday and in-person on Tuesday and back to telehealth on Wednesday. That's completely fine. You can do both. You'll just need to check with your provider, the core provider, to make sure that they are authorized to provide those services through telehealth.
That sounds really encouraging and empowering. Any questions from the audience before I ask my next and last question? All right. Well, this is my last question, just for this section there is. I am categorized as a African-American, but I have a lot of mixture in there. There might be some Portuguese, Cherokee, and some other stuff I'm still finding out about. And it's hard sometimes for me to find a therapist. Would you recommend that I call my healthcare provider, my health management organization, and ask them I need them to help me to find someone who's culturally, I don't like to say competent, but that's what I'll use for now.
Yeah, so we strongly believe in cultural humility and cultural competence in our workforce. We want to see a diverse workforce that reflects the people who are receiving these services. So I do think that that's a great conversation to have with your health insurance company or with your care coordinator if you have one, and to say, this is important to me. Perhaps you want to receive services from someone with a similar or like cultural background, or maybe you just want someone who's been trained to have sensitivity to your cultural background. I think that that's a conversation you absolutely could have with your health insurance company. It's also something that should be talked about during the person-centered planning process. When you get to a core provider, they should be asking you those questions about which pieces of your identity are important to you and how they can honor and respect those parts of your identity. So I think that cultural competence should be woven throughout the behavioral health system, starting with the health insurance company, but going right down to the core provider and the individual staff person.
That's wonderful. Thank you so much. So, in the interest of time, we're going to move right along. Next slide, please. Ooh, grievances and quality issues. Everyone, put your ears to whatever it is that the device you're using, and we're going to bring that to you by our own Frankie Herman from the Urban Justice Center. Woo-hoo. I pass it over to you, Frankie.
Thank you so much, Sandra. I'm going to go through some of this a little bit quickly because we're short on time. I want to make sure that we have a little bit of time in our breakout sessions, but I just want to reassure everyone that the resources I'm bringing up will be in the slides, so you'll definitely have those phone numbers. You don't need to scramble to write anything down. And anything that I say here, you can always call and contact us and ask those questions if you want a refresher. Next slide, please. So in the state of New York, there's a lot of different types of free legal assistance or advocacy assistance that is available. This assistance is totally confidential. And I'm kind of going to just go through a couple of different types of assistance. And then there's a few different organizations you can contact. And if those organizations are not the ones to assist, they will be able to, in almost all cases, give you a referral to someone who can. Some very rare instances where nobody does that kind of work, but in most cases. So the types of assistance that are available kind of go from self-help all the way through to representation. If you call and you need just kind of like advice about how to resolve whatever the issue is, let's say you are trying to get connected with a peer support specialist and you're having trouble getting a hold of your care coordinator under BHHCBS, the old system, or now we're in the core system and you're not really sure how this whole licensed practitioner of the healing arts thing works, and you just need a reminder, someone to kind of let you know, here's steps, 1, 2, 3. That's what needs to happen in order for you to get to the experience or the supports that you're trying to get. So that's some types of services that are available. There's sort of, again, an intermediary step where maybe there's an issue. Maybe you feel like you were mistreated by somebody in your support plan, and you have a complaint about how you were treated. You want to know, where do I make this complaint? How do I resolve this issue? An individual might be able to help with, an advocate might be able to help investigate, like what actually happened, discuss things with different parties, and figure out, kind of what's the next steps for filing a complaint. That advocate also might be able to file the complaint on your behalf. So would be able to write the complaint up for you, file it, of course, with your permission and consent on your behalf. And then a third option is representation and advocacy for your rights. So that could be representation in something called a fair hearing. A fair hearing is a legal process where an administrative law judge would decide, is it, for example, if the insurance company is denying you medication that you need, and your doctor has said, oh yes, this person definitely needs this medication and everything kind of looks good, but then the insurance anyway is saying, no, you can't have it. Potentially that could go to a fair hearing. And then an administrative law judge would decide, oh, was the insurance company correct? in denying you this medication, or are you correct in that the law and the regulations support and the facts support you receiving this medication? You can always do a fair hearing yourself, but in some cases there is advocates or attorneys who can represent you and advocate for your rights. So next slide. And so just kind of repeat everything that was on that arrow piece a second time. If you have kind of problems, you have questions, you need to contact somebody, there are free expert advocates that you can contact. Expert advocacy can help people and their families. So a family member can call on behalf of another individual sometimes if they're looking for assistance in that way to get some advice, to resolve issues in accessing your substance use or mental health supports. We can advise you how to file complaints and appeals if you want to do something yourself. If you want a little more hands-on approach, we can assist with investigating, resolving complaints and violations, writing a complaint on your behalf, submitting it on your behalf with your consent, of course, or represent you and help you advocate for what it is that you want in a variety of processes, including a fair hearing. And again, these services are free and confidential. Next slide, please. So there are a couple of different organizations that I'm going to kind of just name here. These organizations do slightly different things and have slightly different types of advocacy available. But if you contact one of them and they cannot assist, we all are happy to support our colleagues and support you as an individual, get you a referral to somebody who can assist. So the first one I'll mention is ICANN. It's the Independent Consumer Advocacy Network. And the Urban Justice Center Mental Health Project, who is the host of the Access to Recovery Coalition, I work for the Urban Justice Center Mental Health Project, are the statewide specialists and the Ombuds program for Medicaid HARP. Folks in our office have a pretty deep knowledge of Medicaid HARP, and what we don't know, we'll let you know that we don't know that, and we need some time to research it. So this is anybody who has Medicaid HARP wants to know if you have HARP. A lot of people who have HARP are unaware that they've been unenrolled for a variety of reasons. And you can contact ICANN at the phone number on the screen here or at the email address on the screen here. The other organization that I want to mention is CHAMP. That's the Community Health Access to Addiction and Mental Health Care Project. They are the Ombuds program statewide specialists for all substance use and mental health care, regardless of what type of insurance you might have, or if you have no insurance at all. So if you don't have Medicaid at all, or you have no insurance, or you're not sure if you have HARP, these are also folks that you can call for information and advocacy. Next slide, please. So there's a couple different types of actions just to kind of review. Okay, when I call, what's going to happen, right? We can either advise you or on your behalf, contact a member services at your healthcare plan, or if that person is not being helpful, you can always elevate to asking to speak with a supervisor or quality assurance program. There's also, you can file a complaint or grievance with the health plan itself. We can file a complaint or grievance with your provider. We can file a complaint or grievance with, or fair hearing with the state. I want to note with fair hearings that there's some steps that are required before you're allowed to file a fair hearing, and that there's some deadlines that are important. So if you ever get a letter that says you've been denied or reduced, or if you ever get a letter that says that you're having a reduction in services, you want to call one of these lines right away, because there's some rights that are important that are time sensitive. If you're asking for a new service and they say, no, you're not allowed to have this service, you also will want to, call, and you can get assistance with understanding the sort of like the way that they phrase a lot of these letters. I think it takes a little studying, or it took me a little studying to understand. And I'm more than happy to share that knowledge, and other folks are also more than happy to share kind of, their supports and answer your questions. Next slide. Okay. They get the same premium coverage as the nation's leading. Okay. We had somebody.
I want to defer to you that we do need time to go into the breakout rooms where people can ask their questions. Do you think this would be a good time for us to just go right into the breakout room so that they can ask the questions that they have?
Yeah, I think that's a great idea. So we're going to do a breakout session for about 10 minutes. And then we'll come back together just to kind of all say goodbye to each other and see if there's anything that came up in the breakout session that folks wanted to share with the bigger group. Now, if you are a person who wants to be in a room with the ASL interpreters, please direct message me, or you can message the whole list, whichever you're more comfortable with, and I will make sure to assign you to the correct room. It's going to take me a couple of minutes to get folks assigned to the right room, so you don't have to do anything. I'll put you in the room, but give me a minute or two while I go through the list of our attendees today. And it's really your space to come as you are. You can ask your questions, share your experiences, be yourself. And yeah, I think that's it. We're ready to transition.
Thank you, Frankie. So I hope people are coming back. We were in, this is Chaplain Sandra speaking. We were in group number 7, and we had just a few people there. And we had some who listened more than they spoke, and that was quite all right. If you think of anything that you'd like to ask, please contact us. And I want to thank Ms. Kathy Knox. She was just really sharing, Frankie, how the grievances and how you go about it and who to call was very empowering for herself and for the people that she serves. So thank you, Ms. Kathy.
Oh, great. I'm glad to hear that. Can we get to the next slide? We just have like a little after the town hall, some info to share. And then I'll let you share that info there, Sandra. Thank you.
Sure. So as you see here, these are some resources that you can use right now. Access to Recovery is the coalition that was started in August 2021, because sometimes it's hard to find the services you need, the supports you need. And so there it is, Access to Recovery. That's our website through the Urban Justice Center. And then also we have the Office of Mental Health, CORE. And so that is how you can also ask questions and connect to the right agency or referral, or if you have a question, they are there to help as well. So I want to thank you for coming to our town hall session. And if there's any questions, any takeaways, anything that you want to say that really helped you, any information you would like to have, now is the time. We have a few minutes. Any takeaways? Well, right now I want to thank all of our presenters, Katie and oh Lord, I'm forgetting the next person. Not because you're not.
There's someone trying to ask a question.
Sure, who is that? Who's trying to ask a question? Come forward. We'd love to hear your question.
One of the questions that came up in our group that I want to ask, because I thought it was a really good question, I wish I knew the answer, was the role of peer navigators under CORE or through CORE.
Mm-hmm.
What would their role be? I think was the question that came up in our group.
Okay, well, I'll say something because I am a peer specialist and peer advocate, and I do more navigating than counseling, and that's what we do. So let's just say that one of my peers needed to understand the ins and outs of Social Security, and maybe they think that you know, there's something wrong with the calculation, or they should get more money. And they don't know what to do. Who do you call? What's the grievance process? Or what are the forms? I, as the peer navigator, would help to navigate them through that process, through the peer hearing. And what if the person I'm serving they wanted to have a special kind of service that would support them as far as, I don't know, self-esteem, building self-esteem, and it wasn't approved. How do you go about that? You know, how do you advocate for that? And what if you needed just someone to help you practice advocating for yourself? You want to go in and you want to advocate for yourself, we can just practice that. So navigating the services can be challenging, but with a peer navigator, especially when you want to go back to work, you know, what are the steps? You know, I just go back to work and, you know, I still get my Social Security check, or do I need to let them know that I'm not double dipping? So the peer navigator will help you navigate whatever it is that you need at whatever time that you need it and the way that you want it. So if there's anyone else who'd like to say anything else about the peer navigator and how we support our peers. And we're
Thank you,
supporting.
Chaplain.
Daniela put some information in the chat. Daniela, did you want to respond? And then we'll go to Philip.
Oh, sure. I just put in the chat that navigators can help people sort of access core services. They can help you identify providers in your area. They can help connect you with those providers and really just listen to you and take into account what your needs and your preferences are and help make those connections with you and kind of work with you throughout the referral process.
Excellent. Thank you, Daniela. And Philip, you have your hand up. Please come forward.
Thank you. So as a peer specialist at Fountain House, you know, part of my work as a peer navigator is if a fellow peer, you know, wants to become a member, you know, of a clubhouse, you know, like Fountain House, Venture House, you know, whatever clubhouses there are in the state, that, you know, we get that process going by, we are allowed to, you know, complete psychosocial, but the psych eval, you know, has to be done by a, you know, a licensed, you know, therapist or psychologist, and we help, you know, connect those peers to, you know, either a therapist or psychologist, or a psychiatrist if they don't have one, to get the psychosocial. And we use a template from an organization called CUCS, and I always forget what that acronym stands for. Center for Urban, man.
For urban
I'm
community
sorry,
services. For urban
yeah,
community.
that's right. Yeah, that's right.
You got it.
Thank you. So, so those are some other ways that a peer navigator can, you know, support a peer receiving, you know, services.
Excellent.
Okay.
Frankie just put the CUCS website in the chat.
All right. We are at 3 o'clock. You wanna take us out, Chaplain Mitchell?
Well, wonderful. I just want to thank everyone for their presence, everyone for coming. Happy new transformative you in 2022. We're going to be here at the same time, same station on January 28th, 1:30 to 3 o'clock. Just register if you haven't already and just be with us. And if you think of anything, just please contact us. And after the third series, which is January 28th, the whole team will put all of your questions, all of your information, all of the things that you said, you put in the chat, and we're going to give that to you, and then we're going to give you the resources. So bear with us. So that will be coming in the first or the second week of February. We'll be reaching out to you. Any questions before then, just reach out to us, and we are here for you. Thank you so much, core presenters. Thank you, Katie and Lynn. Thank you, Chris. Thank you, all the whole OMH team, all the core team. Thank you for the DOHMH. Thank you for everyone, all of our techie people. Daniela, yay. And just thank everybody at the ATR Coalition. This has been wonderful. I've learned a lot. I feel empowered, and we're going to have more and more of these town hall meetings so that you can be empowered and get back the life that you decide that you want. Thank you for coming.
Thank you.
Thank you, Sandra. Have a
Thank
good one,
you,
everyone.
Thank you,
Chaplain.
Chaplain Mitchell. Thank
Thank you,
you.
everybody.
Thank you, everyone.
Thank you.